All right, so my name is Chinmay Patil, and together with Jennifer Bake, Jacqueline Ural, and Natalie Koskela-Staples, our research project is on the caregiver influence on physical activity engagement on youth with comorbid obesity and asthma. Adolescents with comorbid obesity and asthma suffer from more adverse health conditions, such as sleep apneas and depression. And unfortunately, youth with obesity have a 60% increased risk of developing comorbid asthma, and youth with comorbid obesity and asthma engage in less physical activity than those with only one disease. Because caregivers play such a crucial role in supporting youth physical health, our research aims were to understand the caregiver influence and caregiver attitudes towards youth physical activity engagement, and also various barriers and facilitators to physical activity engagement amongst youth with obesity and asthma. In the experiment, the social cognitive theory was used. The social cognitive theory is a theory of behavior, and essentially, the social cognitive theory states that people learn through observation. So, for example, a child that was uh, in a household with unhealthy lifestyles, such as a lack of physical exercise or a lack of healthy food, for example, has a high risk of passing on those unhealthy lifestyles onto those next generations. In the experiment, caregiver youth diet interviews were analyzed, and the interview questions, such as the one provided about physical activity on children, will focus on dyad attitudes towards balancing physical activity with obesity and also asthma. And the next steps, the research and interviews will be conducted, and essentially, the research and interviews will provide a better understanding of the risk factors and a better understanding of the complexities of both diseases. Ultimately, the research will help caregivers understand their influence on physical activity on their adolescent children with comorbid obesity and asthma, and will also help those caregivers create treatment plans for their children.